Hi, everyone. TJ All, it's I-45 now. This breaking news, we have our first child-related COVID-19 death in Galveston County. A young child died Tuesday, according to Galveston County health officials. And joining us right now is the head of the Galveston County Health District, also our local health authority, Dr. Philip Keiser. Dr. Keiser, what can you tell us about this child's death? And what should folks know about this if they have a concern?
Well, there was a child that was under age 10 that died at home and was taken to the medical examiner's office, and they determined that the cause of death was COVID. That's about all we know at this point. We're still investigating it. The child was in school in a pre-K in Galveston County, and but we've investigated that, and we do not believe that this is related to her being in school. We are aware that there were other family members that also had COVID, and so we don't think the exposure was school-related.
And we should point out, too, that at this point, according to the Galveston County Health District's data that we get each day, that there does show one child between the ages of 0 and 10 who's in the hospital. This child who passed away, she was not that particular person. We're trying to obviously protect the IDs here,
right.
But this child was not hospitalized, was at home, correct?
That's correct.
At this time, there are going to be concerns, obviously, with a lot of folks. If they have a child in school, we have been able to confirm independently this child was a student at Little Elementary in the Dickinson School District. We got that as an independent source through the medical examiner's office. But let me ask you here, Dr. Keiser, what concerns are and concerns should people have about their children? Because obviously this child was under 12 years old and was not eligible, at least officially right now, to be vaccinated. What needs to be done right now to protect people's children?
I think there are a couple things that come up immediately. I think the first one is that if your child is under the age that can be vaccinated and they get COVID or they have symptoms, which might be COVID, you should take them and seek care right away. Most kids do absolutely fine. In fact, many kids are asymptomatic. But if your child is having some sort of symptoms, it's a good idea to take them to be seen. It's also a bad idea to assume it's COVID and there's nothing you can do about it. I mean, it could be something else. And so, it's very, very important to make sure that you seek medical care. I think that's the first lesson here. I think the second thing is that it just reemphasizes that most COVID transmission occurs at home. And when one person in the family gets it, it usually takes 5 days or less for the entire family to get it. And so what that means is that particularly for the older members of the family, if you want to protect your family, get vaccinated. That's the best way to protect your family from something like this happening.
And you pointed out, because there had been a long time discussion that children, while they may contract COVID, would be most of the time asymptomatic long before the vaccines came along, and that the number of cases of a child becoming sick from COVID-19 and seriously sick were so rare. It is still rare based on the stats, but this one is kind of a shock to the system,
right.
Being as that this child being 4 years old, and
right.
so young. To have this happen. It's heartbreaking, we know, for the parents, but can you at least stress that? Is that something maybe we've been hearing that the Delta variant does have a more effect on the younger children than the previous strains?
Well, we're certainly seeing more kids coming with COVID, and it's a combination of the Delta variant being much more transmissible, and so more people are getting it. It's now we're seeing our single largest group of people with COVID are children under 10. So the fact that we're getting more and more children under 10 getting COVID, it shouldn't surprise us that some of them are getting sick, some of them are getting in the hospital, and even some of them dying. So from that point of view, it's not a surprise. I think we've been waiting for this for a while. But we don't want people to panic because, again, it's not likely. And I think if people intervene early, there are things that you can do.
Dr. Philip Keiser, local health authority for Galveston County, on with us, talking about the death of a 4-year-old girl. She is from Bacliff, who had passed away on Tuesday. She was found at home. Medical examiner then determined it was a COVID-related death. Anything else you think is important for the public to know, Dr. Keiser?
No, I don't. I mean, I think it's, this is, again, it's very sad. It's very sobering. I hope that this will be an opportunity for people to, start putting away some of, the anger that everyone has about COVID and realize that this is serious, and do everything that you can to prevent this, and also, go home and hug your kids.
And to clarify too, if you would, were there others in the household, from what's been able to determine, that were infected with COVID, and were they indeed vaccinated? Are you able to elaborate on that some?
There were other people that were positive for COVID.
And we cannot talk about their vaccination status. I just want to be clear on that.
Yes, that's correct.
Gotcha. All right. Dr. Philip Keiser, the local health authority for Galveston County, is on with us. Our continuing coverage continues here on I-45 Now.